Welcome to our channel Sisums. In this video, we'll be exploring varicose veins, diagnosis, and treatment. Varicose veins are enlarged, swollen veins that often appear on the legs and can cause discomfort or cosmetic concerns. We'll dive into what causes these veins, the symptoms to watch out for, and the latest diagnostic techniques. We'll also cover various treatment options, from lifestyle changes and compression therapy to minimally invasive procedures. Whether you're seeking relief or simply want to learn more, this video has you covered. Don't forget to like, subscribe, and hit the
Varicose veins are twisted, enlarged veins that typically appear in the legs and feet. While often considered a cosmetic concern, they can sometimes cause discomfort and indicate an underlying circulatory issue. Veins carry deoxygenated blood back to the heart, relying on one-way valves to prevent blood from flowing backward. When these valves weaken or become damaged, blood can pool in the veins, causing them to stretch and bulge. Factors like age, genetics, prolonged standing or sitting, obesity, and pregnancy can increase your risk. Understanding these risk factors and adopting a proactive approach to vein health can significantly reduce your chances of developing this condition. Let's explore the mechanics of blood flow and vein function next. To understand varicose veins, it's crucial to understand how blood circulates throughout the body. Arteries carry oxygenated blood away from the heart, while veins return deoxygenated blood back to the heart. Veins face a unique challenge, transporting blood upward against gravity, especially in the legs. One-way valves in veins open to allow blood flow towards the heart and close to prevent it from flowing backward. When these valves weaken or become damaged, blood can flow backward and accumulate in the veins. This pooling of blood puts pressure on the vein walls, causing them to stretch, bulge, and twist, resulting in varicose veins. Understanding the relationship between valve function, blood flow, and vein structure is key to comprehending varicose veins. Next, we'll delve into the specific causes and risk factors. Varicose veins develop when the one-way valves within the veins weaken or become damaged. Age is a significant risk factor, as the valves in our veins naturally weaken over time. Family history also plays a role, suggesting a genetic component to varicose vein development. Prolonged standing or sitting can contribute to varicose vein formation. Standing or sitting for extended periods puts increased pressure on the veins in your legs, making it harder for blood to flow back to the heart. This can weaken the valves over time and increase your risk of developing varicose veins. Other risk factors include obesity, pregnancy, and hormonal changes. Obesity increases pressure on the veins in the lower body, while pregnancy increases blood volume and puts pressure on the pelvic veins. Hormonal fluctuations, particularly those associated with pregnancy and menopause, can weaken vein walls and contribute to valve dysfunction. Understanding these risk factors can empower you to make informed decisions about your health. Varicose veins often present with noticeable visual symptoms, making them relatively easy to identify. The most common symptom is the appearance of twisted, bulging veins beneath the skin's surface. These veins are typically blue or purple and may appear rope-like or resemble spider webs. Varicose veins most commonly affect the legs and feet, as these veins are farthest from the heart and must work against gravity to return blood upward. In addition to the visible signs, varicose veins can cause a range of uncomfortable sensations. You may experience aching, heaviness, or a feeling of fatigue in your legs, especially after prolonged standing or sitting. Some people describe a throbbing or burning sensation in the affected areas. Other symptoms can include swelling in the feet and ankles, particularly in the evening. The skin surrounding the varicose veins may become dry, itchy, or discolored. If you experience any unusual symptoms or notice changes in your varicose veins, it's essential to consult a healthcare professional promptly. Diagnosing varicose veins typically involves a combination of physical examination and medical imaging. A healthcare professional will begin by taking a detailed medical history and inquiring about your symptoms. During the physical exam, the doctor will visually inspect your legs and feet, checking for the characteristic signs of varicose veins. To confirm the diagnosis, your doctor may recommend a non-invasive imaging test called a duplex ultrasound. This painless procedure uses sound waves to create images of the veins in your legs, allowing the doctor to visualize blood flow and assess the severity of the varicose veins. The information gathered will help your doctor determine the most appropriate treatment plan for your specific needs. While not all cases of varicose veins are preventable, adopting certain lifestyle changes can significantly reduce your risk. Regular physical activity improves blood flow, strengthens leg muscles, and aids in weight management. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Activities like walking, swimming, cycling, and yoga are particularly beneficial for vein health. Maintaining a healthy weight is crucial for reducing pressure on your veins. Focus on a balanced diet rich in fruits, vegetables, whole grains, and lean protein while limiting processed foods, sugary drinks, and saturated fats. Avoiding prolonged standing or sitting is essential for promoting healthy blood circulation. If your job requires you to stand or sit for extended periods, take frequent breaks to move around and elevate your legs whenever possible. When sitting, avoid crossing your legs, as this can restrict blood flow. These lifestyle modifications can alleviate symptoms if you already have varicose veins. Compression therapy is a cornerstone of varicose vein management, effectively alleviating symptoms and improving overall vein health. It involves wearing specially designed elastic stockings or bandages that apply graduated pressure to the legs, promoting blood flow back to the heart. Compression stockings work by gently squeezing the veins in your legs, narrowing them, and preventing blood from pooling. This compression helps improve blood flow, reduce swelling, and alleviate symptoms such as aching, heaviness, and fatigue. Compression stockings come in various lengths, pressures, and styles to suit individual needs and preferences. Your doctor will recommend the appropriate level of compression and type of stocking based on the severity of your varicose veins. It's important to wear compression stockings as directed by your doctor to experience their full benefits. Compression therapy is a safe and effective treatment option for most people with varicose veins. Sclerotherapy is a minimally invasive procedure, primarily used to treat spider veins and smaller varicose veins. It involves injecting a solution directly into the affected veins, causing them to shrink and fade over time. During the procedure, a fine needle is used to inject a solution called a sclerosant into the affected veins. The sclerosant irritates the lining of the vein, causing it to collapse and seal shut. Over time, the treated veins are reabsorbed by the body, and blood flow is redirected to healthier veins. Sclerotherapy is typically performed in an outpatient setting and requires no anesthesia or incisions. You may experience mild discomfort during the injections, but this is usually well tolerated. Multiple sclerotherapy sessions may be required to achieve desired results, depending on the number and size of the veins being treated. Sclerotherapy is a highly effective treatment option for spider veins and smaller varicose veins, providing long-lasting aesthetic and symptomatic relief. Endovenous ablation is a minimally invasive procedure used to treat larger varicose veins. This technique uses heat or radiofrequency energy to cauterize and close off the affected veins, redirecting blood flow to healthier veins. During the procedure, a small catheter is inserted into the affected vein using ultrasound guidance. Once in place, the catheter delivers heat or radiofrequency energy to the vein wall, causing it to collapse and seal shut. The treated vein gradually shrinks and fades over time, while blood flow is rerouted to healthier veins. Endovenous ablation is performed on an outpatient basis using local anesthesia. Most patients experience minimal discomfort during and after the procedure. Recovery time is typically shorter than with traditional surgery, and you can expect to return to your normal activities within a few days. Endovenous ablation is a highly effective treatment option for larger varicose veins, offering long-lasting relief from symptoms and improving the appearance of the legs. While minimally invasive techniques have largely replaced traditional vein stripping surgery, surgery may still be an option in severe cases. Surgical intervention aims to remove or tie off the affected veins, providing lasting relief from symptoms and preventing complications. Vein stripping involves surgically removing the affected vein through small incisions made in the groin or ankle. Another surgical option is ambulatory phlebectomy, which involves removing smaller varicose veins through tiny punctures in the skin. Surgical treatment for varicose veins is typically performed on an outpatient basis, using local or general anesthesia. Recovery time varies depending on the extent of the surgery, but is generally longer than with minimally invasive procedures. Your doctor will provide detailed instructions on post-operative care, including wound care, pain management, and activity restrictions. While not all cases of varicose veins are preventable, there are steps you can take to reduce your risk and promote healthy circulation. Regular exercise improves blood flow, strengthens leg muscles, and helps maintain a healthy weight. Engage in at least 30 minutes of moderate intensity exercise most days of the week. Maintaining a healthy weight is crucial for reducing pressure on your veins. Focus on a balanced diet rich in fruits, vegetables, whole grains, and lean proteins while limiting processed foods, sugary drinks, and saturated fats. Avoiding prolonged standing or sitting is essential for promoting healthy blood circulation. If your job requires you to stand or sit for extended periods, take frequent breaks to move around and elevate your legs whenever possible. By incorporating these preventive measures into your lifestyle, you can significantly reduce your risk of developing varicose veins and enjoy healthy, vibrant legs for years to come.